evening, everyone. So today we'll be discussing some MCQs on mandibular molars. Am I audible? So today we'll be discussing some MCQs on mandibular molars. In last class we discussed some MCQs on maxillary molars. So today we'll be discussing mandibular molars, right? So let's start with the first MCQ. In mandibular molars, which dimension is always greater, right? So let's say this is a typical mandibular molar. This is the first mandibular molar, right? So which dimension is always greater? So this is the mesiodistal dimension, this is the buccolingual, and the crown height, that is the cervico-occlusal dimension, right? Cervico-occlusal dimension. So which is greater, buccolingual, mesiodistal, cervico-occlusal, or all the dimensions are equal? Now obviously all the dimensions cannot be equal, right? So the mesiodistal dimension is somewhere around 11 millimeters and the buccolingual dimension is somewhere around 10 millimeters. So when you compare this to the maxillary molars, what you'll notice is that in the maxillary molars, let's say this is a maxillary molar, right? This is a maxillary molar, and in the maxillary molar the mesiodistal dimension is 10 millimeters and the buccolingual dimension is 11 millimeters, right? So for the maxillary it is the buccolingual dimension that is greater, but in the mandibular molars it is the mesiodistal dimension that is greater. So the correct answer for this question would be option B, that is mesiodistal dimension, right? So the mesiodistal dimension is greater for this question. Can you please try to participate, right? So whenever we are going to a question, please try to participate, please try to answer. गलत हो सही हो कोई दिक्कत नहीं है, ठीक है? Try to participate, try to answer. तो यहाँ पर क्या है, जो mesiodistal dimension है, that is greater than the buccolingual dimension. So these are the wider crowns, right? Or you can say the widest, mesiodistally the widest teeth in the human dentition are mandibular molars, and amongst these the lower first molar is the widest, right? The lower first molar is the widest. So let's go to the next question. The mandibular first molar usually erupts at what age? So chronology में से एक question हो गया, right? When does it erupt? And which two? It is the mandibular first molar. So just like the maxillary first molar, the mandibular first molars, these are the first permanent teeth to erupt, isn't it? These are the first permanent teeth to erupt. Also, the molars are non-succedaneous. So they erupt distal to the primary dentition. They erupt distal to the primary teeth, right? So just distal to the mandibular primary second molar with the mandibular permanent first molar erupt, isn't it? And it erupts at an age of about 6 to 7 years. To be more specific, it erupts at about 6 years, right? It erupts at about 6 years. Its calcification begins at birth. So just like the maxillary first molar, the mandibular first molar also begins calcification at birth and they erupt at the age of about 6 years, right? अगर हम इसमें और chronology में आगे जाएं, just like the maxillary first, second and third molars, the mandibular first molar, it initiates at birth, its crown completes at 2.5 to 3 years, right? And then it erupts at 6 years and its root completes at about 9 to 10 years, isn't it? So what about the 7? 7 would initiate when the first completes. So when the first completes at about 2.5 years to 3 years of age, at that time the second molar initiates, and it would complete at about 7 to 8 years, isn't it? And it would erupt at about 12 to 13 years. It is often called 13-year molar, isn't it? So similarly, what about the third molar? The third molar would initiate at the age the second molar completes, and it would erupt at about 17 to 21 years of age. Sorry. It would complete at about 13 to 14 years of age, and it would erupt at about 17 to 21 years of age. Right? So the correct answer here would be 6 to 7 years. So the chronology of mandibular molars is almost similar to that of maxillary molars. Right? तो अगर आपको एक भी याद रहती है तो आप दूसरे को अपने आप ही रिमेम्बर कर पाएंगे, है ना. आगे अपन चलते हैं थर्ड क्वेश्चन पर. Which cusp of mandibular first molar is the smallest? तो sequence of the size of the cusps, right? Mandibular first molar है सबसे पहले तो, and we need to find the smallest cusp. तो इसमें smallest cusp कौन सा होगा? Let's say this is the mandibular first molar, right? Mesial side, distal side, this is the buccal and this is the lingual side. तो ये तो हो गया mesiolingual cusp, ये हो गया distolingual, this is the mesiobuccal, distobuccal and this is the distal cusp. So which amongst these five do you think is the smallest cusp? Obviously, as you can see, the distal cusp is the smallest cusp. Right, distal cusp is the smallest cusp. Now, which is the largest cusp? The largest cusp would be mesiobuccal cusp. So, largest is mesiobuccal, followed by mesiolingual, followed by distolingual, then distobuccal, and then finally it is the distal cusp that is the smallest. Right? तो अगर हमें सीक्वेंस बनानी हो कि कौन सा cusp इसमें सबसे बड़ा है, so it is the mesiobuccal that is the largest, followed by mesiolingual, then distolingual, then distobuccal, and then finally distal cusp is the smallest. So this is for the first molar. This is for the first molar. And the second and third molars, we don't have this distal cusp, right? So in second and third molars, which cusp would be the smallest? It would be the distobuccal cusp, right? The sequence of the size of cusp would remain same in the first, second, and third molars. Unlike maxillary molars. Maxillary molars में मैंने आपको क्या बताया था last time? The distolingual cusp, that is the secondary cusp. So reduction in the size of distolingual cusp is greater as compared to the other cusp. So while the distobuccal cusp is smaller in the first molar, it is the distolingual cusp that is smaller in the second and third maxillary molars, right? पर यहाँ पर कौन सा smallest है? Distobuccal cusp would be the smallest if distal cusp is excluded. और क्योंकि फर्स्ट मोलर में डिस्टल कस्प है तो यहाँ पर तो डिस्टल कस्प ही स्मॉलेस्ट होगा. तो आंसर क्या हो गया इसका? ऑप्शन डी, डिस्टल. वेरी गुड निमिषा, राइट? यस, वेरी गुड. द सीक्वेंस इज करेक्ट. mesiobuccal, mesiolingual, distolingual, distobuccal and distal. Very good nimisha. So let's go to the next question. The mesiobuccal and distobuccal cusps of mandibular first molar are separated by which groove? So mesiobuccal, distobuccal, then this is the distal and the lingual cusps, right? So which groove do you think separates the mesiobuccal and distobuccal cusps? So we need to identify this groove, right? It is this groove that separates these two cusps, mesiobuccal and distobuccal groove. And then this is the another groove, and here we have the lingual groove. So there is a single lingual groove, but there are two buccal grooves, isn't it? One on the mesial and one on the distal side. So the one that is on the mesial side would obviously be called mesiobuccal groove, and the one on the distal side would be called distobuccal groove, isn't it? नहीं निमिषा, central groove तो ये पूरा ग्रूव है, राइट? दिस इज द एंटायर सेंट्रल ग्रूव. But we are talking about these cusps, isn't it? We are talking about these cusps. Which groove would separate these cusps? So it is this groove that is crossing, between these cusps, right? तो इनके बीच में से कौन सा ग्रूव क्रॉस कर रहा है? इनके बीच में से क्रॉस कर रहा है मेसियोबक्कल ग्रूव स्पेसिफिकली, राइट? सेंट्रल ग्रूव तो मेसियोडिस्टली एक्सटेंड कर रहा है and it joins both lingual and the बक्कल ग्रूव्स. तो ये बक्कल ग्रूव से भी ज्वाइन हो रहा है, लिंगुअल ग्रूव से भी ज्वाइन हो रहा है. That does not mean that the central groove is extending onto the buccal or onto the lingual surface. तो central groove extend नहीं कर रहा है. It is the buccal groove, right? तो यहाँ पर हो गया मेसियोबक्कल और यहाँ पर हो गया डिस्टोबक्कल ग्रूव. And then this lingual groove is on the lingual surface. तो यहाँ पर हमारा करेक्ट आंसर क्या होगा? यहाँ पर होगा ऑप्शन बी, that is मेसियोबक्कल groove, right? Now, if I asked you, these are the grooves on the mandibular first molar. What about the mandibular second molar? Do we still have these three grooves? That is mesiobuccal, distobuccal, and the lingual grooves, or do we have lesser grooves, or do we have more grooves? तो क्योंकि mandibular second molars में या third molar में distal cusp नहीं होता, right? अगर हम mandibular second या third molar की बात करें, तो इस तरीके से कुछ दिखेगा हमें mandibular second molar, right? So there won't be any distal cusp, and for that reason we have a single buccal cusp and a single lingual cusp. So this single buccal cusp would be called buccal groove and lingual groove. So unlike first molar, we don't have either mesiobuccal groove or distobuccal groove. तो ना तो हमारे पास mesiobuccal groove है, ना ही हमारे पास distobuccal groove है. We just have a buccal groove. This is just called a buccal groove. We neither call it distobuccal nor we call it mesiobuccal. Clear? It is just the buccal groove. Now imagine a molar, a mandibular molar, which does not have a, let's say, distolingual cusp, which maybe just has a single lingual cusp. So in that case, the lingual groove would also be missing. So exceptionally, in those teeth where a cusp has not developed or is underdeveloped, and maybe there is not a groove crossing onto the lingual surface, in those cases, specifically in the third molar, we might sometimes not have the lingual groove. Is it clear? So sometimes when the lingual cusps are not well developed, when one of the lingual cusps is absent, the lingual groove is also absent. But buccal groove will always be present. Is it clear? So usually this happens in the maxillary third molar, where we have that heart-shaped occlusal anatomy, right? तो वहाँ पर lingual groove absent होता है. The occlusal groove pattern of mandibular first molar is typically. तो अब हमें mandibular first molar का occlusal groove pattern, right? Or you can say central groove pattern. So when you say occlusal groove pattern, this occlusal groove pattern is nothing but the central groove, right? तो central groove का हो, occlusal groove का हो, एक ही बात है. किसमें देखना है? In the maxillary, in the mandibular first molar, right? So let's again take a look at the mandibular first molar. So when you look at the mandibular first molar, what were the options? I think the options were Y-shaped, plus-shaped, right? And H and irregular. H and irregular. So which of these four do you think would be the correct answer? Now this here is the central groove, isn't it? This is the central groove. So what do you think should we call this shape? So what should we call this shape? An irregular shape, H shape, plus shape, or Y shape? So the correct answer here would be option A, that is Y shape. So it is a distorted Y shape, isn't it? It is a distorted Y shape. तो अगर हम इसे exactly बोलना चाहें तो हम क्या बोलेंगे? It is a distorted Y shape. isn't it? So option B is the best option amongst these 4 options. Is it clear? So shall we go to the next question? अच्छा, अगर कोई आप पूछे what is the central groove pattern in case of a mandibular second molar? This is the mandibular second molar. And what is the pattern of the occlusal groove or the central groove on a mandibular second molar? So as you can see it very clearly, the pattern of central groove on mandibular second molar resembles a plus shape, isn't it? Or a cross shape. So plus or cross shape, that is the pattern of the central groove on mandibular second molar. And third molar, usually it resembles the second molar, right? So this is the mandibular second molar, and the mandibular third molar usually resembles mandibular second molar. So usually the central groove pattern on third molar would be plus or cross shaped. So can you tell me on which two an H-shaped pattern of the central groove is seen? ये एक एडिशनल क्वेश्चन हो गया, राइट? क्योंकि हमने H यहाँ पर डाल रखा है, तो कौन से टूथ के अंदर हमें H-shaped पैटर्न ऑफ सेंट्रल ग्रूव देखने को मिलता है? सो इट इज यूजुअली सीन ऑन premolars. Now which premolars? Usually a properly defined H-shaped groove would be seen on upper first premolar and lower second premolar, which has 2 cusps, right? So lower second premolar with 2 cusps and upper first premolar, इन teeth के अंदर हमें clearly defined H-shaped central groove देखने को मिलता है, right? And which premolar also shows a Y-shaped groove pattern? This Y pattern, apart from the mandibular first molar, where else is it seen? तो ये Y pattern एक mandibular first molar में तो हमने देखा यहाँ पर मिल रहा है. Where else is it seen? It is also seen in mandibular second premolar, which is 3 cusp, right? So 3 cusp premolar में mandibular second premolar which has 3 cusps, there you will notice a Y-shaped central groove pattern. राइट? तो वाई शेप पैटर्न कहाँ मिल गया? एक मैंडिबुलर फर्स्ट मोलर में, एक मैंडिबुलर सेकंड प्रीमोलर में, एंड दिस प्रीमोलर मस्ट हैव 3 cusps, राइट? H shape pattern in maxillary first premolar and in mandibular second premolar, where we have just 2 cusps. So the occlusal outline of mandibular first molar is mandibular first molar. इसकी हमें occlusal outline देखनी है. So let's take a look at its picture again, right? तो अगर आप इसकी पिक्चर पे ध्यान दोगे, तो you will easily be able to identify the occlusal outline. So how would you define its occlusal outline? Is it hexagonal? Is it pentagonal? Is it trapezoid? Is it rectangular? Is it square? How would you define its occlusal outline? So just take a look at its outline. And which geometric figure do you think it resembles? A pentagon, an hexagon, a rectangle, a square, or a trapezoid? Which geometric figure does it resemble? How many sides do you see in the diagram that I have drawn? Is it a hexagon? Is it a pentagon? Is it a trapezoid? Or is it something else? So depending on the prominence of the cusps, its size, its shape might vary, right? Sometimes it might appear like an hexagon. Sometimes it might appear like a pentagon. Sometimes it might appear like a trapezoid. Sometimes it might appear like a rectangle, right? But as you can see here, since we have this accentuation of this curve here, that's why usually it appears like a hexagon, right? Whether you refer Wheeler or Wolfel, right? these are the two main books that we usually refer for dental anatomy. So whether you refer either of these, whichever book you refer, you would find that the occlusal outline of mandibular first molar is usually described as an hexagon. But let's say this angle is not such accentuated, right? It is not this rounded. Then what will happen? It will resemble like a pentagon, isn't it? So if the mesiobuccal angle is not that prominent, it's not that rounded, what will happen? Then it will appear like a pentagon, isn't it? 1, 2, 3, 4 and 5 sides, right? So usually it is a hexagon, then a pentagon, then let's say this distal cusp, which is not as well developed in this diagram. Let's say it is well developed. Let's say it is well developed in some cases, right? Let's say it is well developed as it is here. So then it will resemble a trapezoid. And when this distal cusp is entirely absent, then this tooth might resemble like a rectangle, isn't it? So most common shape would be hexagon, followed by pentagon, then trapezoid, and then rectangular. That is the least common shape for the mandibular first molar. हम यहाँ पर first molar की बात कर रहे हैं. So the most common shape or the most common occlusal outline for mandibular first molar is hexagon, and the least common would be rectangular, right? Since we have hexagon here, we will go with hexagonal. Though we also have this rectangular option, right? Yet we have chosen hexagon because this is the most common outline. Now instead of first molar, had this question been about second molar, then which of these options would you choose? अब इसमें से कौन सा ऑप्शन चूज करोगे अगर ये क्वेश्चन जो है मैंडिबुलर सेकेंड मोलर के बारे में होता? तो अगर हम मैंडिबुलर सेकेंड मोलर की बात करें, since the mandibular second molar lacks the distal cusp, it will appear more rectangular, isn't it? It will appear more rectangular, right? So mandibular second molar will appear rectangular. Mandibular first molar, it will appear hexagonal most commonly, then pentagonal, then trapezoid, or least commonly as a rectangular, depending on the size of the distal cusp, right? In case of maxillary molars, we have discussed that the first molar, second molar, they will both appear rhomboidal, and the third molar usually it may appear rhomboidal if it has all the 4 cusps. If it does not have all the 4 cusps, if it has only 3 cusps, then it will appear heart shape, right? So same is for this too. The first molar, it will appear hexagon, pentagon, trapezoid or rectangular, but the second molar will appear rectangular. The third molar resembles the second molar, so it will appear rectangular, right? Third molar will also appear rectangular, right? So let's go to the next question. Which root of mandibular first molar is broader buccolingually? So mandibular molar has 2 roots, right? It has 2 roots, a mesial root and a distal root. A mesial root and a distal root. So when you take a look at these roots from a proximal aspect, right, be it mesial or be it distal, let's say this is the mesial aspect, this is the distal aspect. So the question is asking which root is broader buccolingually? Which root is broader buccolingually, right? So in one of these diagrams you can see the tooth from the distal aspect, and in the other diagram you can see it from the mesial aspect. So I think after looking at these diagrams, it is easy to answer the question, right? Which root is broader buccolingually? So which root is broader buccolingually? This is the mesial root and this is the distal root. Now as you can see that the distal root is narrower than the mesial root, isn't it? A portion of the mesial root can be seen can be seen from the distal aspect, isn't it? A portion of mesial root can be seen from the distal aspect because the distal root is narrower, isn't it? So that's why the mesial root is broader. Mesial root is broader. Buccolingually, isn't it? Mesial root is broader buccolingually. So that is true for all the mandibular molars. In each mandibular molar, the mesial root will be larger as compared to the distal root of the same tooth. So always mesial root is larger than the distal root of the same tooth, isn't it? Good evening. So mesial root is always larger than the distal root. Now if someone asks you which is the largest molar root, right, which is the largest molar root, so let's say if the question is which is the largest molar root, and let's say the options are upper 6 palatal, option B is lower 6 mesial, third option is upper 6 mesiobuccal root, and the fourth option is lower 6 distal root. So which of these four would you choose as your answer? Which is the largest molar root? In the maxillary molars, the palatal root is the largest, but it is not the largest molar root, right? The largest molar root is the lower 6 mesial root, right? The lower 6 mesial root is the largest molar root. It is even the longest molar root with a length of about 14 millimeters, whereas the upper 6 palatal is just 13 millimeters, so approximately 1 millimeter shorter than the lower 6, right? Yes. A for the question 7, option A is correct, but for this question that I have just created here, option B, that is lower 6 mesial, is correct, right? Palatal is the largest maxillary molar root. Usually what happens is, you might be asked to identify the largest root, right? And they might give you the options as upper 6 palatal, upper 6 mesiobuccal, upper 6 distobuccal, and then some other option, maybe lower 6 distal, or some other option, right? So amongst these options, yes, upper 6 palatal is the largest, but if the mesial root of lower 6 is there, then that would be the largest, right? This is also 1 millimeter, approximately 1 millimeter longer than the upper 6 palatal. Is it clear? So depending on your options, you will choose your answer. तो कई बार क्या होता है कि ऑप्शन जो रूटीन में हम क्वेश्चंस देखते जाते हैं, उसकी वजह से हम एक चीज हमारे दिमाग में सेट हो जाती है कि upper 6 palatal is the largest root. That is not true. That is the largest maxillary molar root. If we are looking for the largest molar root, that would be lower 6 mesial, and if we are looking for the largest single root, right, largest single root. Similarly, if the third question is which is the largest single root, and let's say now the questions now the options are upper 3, lower 3, upper 6 palatal, and lower 6 mesial. Now which option would you choose? Now we are discussing about the largest single root, right? Now if we had been discussing about the entire root, then obviously upper 6 has the largest root. It has trifurcated root, isn't it? Upper 3 has a trifurcated root, the lower 6 has a bifurcated, and the upper 6 has a trifurcated root, isn't it? So individually, if we are talking about a tooth, obviously upper 6 has the largest root surface area wise, but in this question we are talking about the largest single root, right? So here the answer would be upper 3, that is upper canine, isn't it? It is also the longest root with a dimension of 17 mm, isn't it? 17 mm. So let's go to the next question. The bifurcation of roots of mandibular first molar is located. So where is it located, right? So let's take a look at the options. Close to the cervical line, that is approximately 3 to 4 millimeters from the cervical line. then middle third of the root, apical third, and it varies, right? So let's take a look at this diagram once again. So this is the buccal bifurcation, and this here is the lingual bifurcation, isn't it? This is the lingual bifurcation, and this is the buccal bifurcation. So always remember that the buccal bifurcation is shorter as compared to the lingual bifurcation. Buccal bifurcation is just 3 millimeters and lingual bifurcation is 4 millimeters. Now when you compare this to the bifurcation in the maxillary molars, in case of maxillary molars, we have trifurcation, isn't it? We have trifurcation. So there would be a mesial bifurcation, a distal bifurcation, and a buccal bifurcation. So there are 3 bifurcations. On the mesial side, it is 3 millimeters. On the buccal side, it is 4 millimeters. And on the distal side, it is 5 millimeters, right? So that is for the maxillary first molar. And as we move distally from first to second to third molars, the size of the root trunk increases. So this bifurcation will move apically from first to second to third molars. So what would be the answer here? Shefali, Nimisha, HS. The bifurcation of the roots in mandibular first molar is located closer to the cervical line, middle third, apical third, or it varies. क्या आंसर होगा इसका? इसका आंसर होगा ऑप्शन ए, दैट इज close to the cervical line, right? 3 to 4 mm. And in case of maxillary molars, it is 3, 4 and 5 mm, right? So depending on the side, maxillary molar का क्या होगा? Mesial में 3, distal 5, buccal 4 millimeters, isn't it? और mandibular molar में buccal is 3 mm and lingual is 4 mm. Clear? So occlusal outline of mandibular second molar is, so I think this we have already discussed, isn't it? We have already discussed it. The occlusal outline of mandibular second molar, and we have already discussed it, isn't it? It resembles a rectangle, right? It resembles a rectangle. So in which of the two teeth, lower 6 and lower 7, right? In which of these two teeth, lower 6 and lower 7, do you think will show more lingual convergence? Yes, very good. Option A, that is rectangular, is the correct answer. Now, which of these two teeth, lower 6 and lower 7, mandibular first and mandibular second molar, which of these two would show more lingual convergence? More lingual convergence किसमें दिखेगी? ये तो option A हो गया, ये option B हो गया, right? Mandibular first या mandibular second molar, which will show more lingual convergence? Which will show more lingual convergence? Is it mandibular first molar or is it mandibular second molar? Option A or option B? This is the option A and this here is the option B. Yes, very good. Mandibular first molar will show more convergence. Why? It has 3 buccal cusps, isn't it? It has 3 buccal cusps, and that's why it shows more lingual convergence, isn't it? It shows more lingual convergence. This is the mandibular first molar. So mandibular first molar में ज़्यादा lingual convergence क्यों है? Because the buccal side is broader as compared to the lingual side, isn't it? So buccal side is broader as compared to the lingual side in the mandibular first molar. But in case of mandibular second molar, the buccal side is almost equal to that of the lingual side, right? The buccal side is almost equal to that of the lingual side. So therefore, it does not show much convergence, and that's why its shape is described as rectangular. Is it clear? So mandibular second molar में, unlike first molar, there is no distal cusp, and therefore the buccal side is almost similar in length to the lingual side, and therefore its shape is rectangular, right? Therefore its shape is rectangular. And yet the cusp size, अगर हम बात करें 7 में cusp size की, तो in 7 the cusp size, it still follows the same pattern, isn't it? It follows the same pattern as in mandibular first molar. Mesiobuccal is the largest and distobuccal is the smallest. Clear? तो फर्स्ट, सेकेंड एंड थर्ड मोलर तीनों में यही पैटर्न फॉलो होगा. सो नेक्स्ट क्वेश्चन, इन द मैंडिबुलर सेकेंड मोलर buccal and lingual surfaces appear equal in width because, तो हमने अभी ये डिस्कस किया है, right? We just discussed it that the buccal and the lingual surfaces, they appear almost equal. And why is that so? Why do they appear equal? So when we say that they appear equal, what we mean is that the lingual convergence is minimal, isn't it? Lingual convergence is minimal. So why is it so? Why is the lingual convergence minimal? Who does not taper lingually? Lingual cusps are reduced, buccal ridge is flat, and roots are fused. तो चाहे तो ऐसे कहो कि इसके cusps जो हैं buccal and lingual ऑलमोस्ट सेम साइज के हैं, या ऐसे कहो कि इसमें lingual convergence नहीं है. Whatever you say, it is one and the same thing, right? तो इन दोनों की width सेम क्यों लगती है? क्योंकि इसमें lingual convergence नहीं है. या lingual convergence नहीं है, क्यों नहीं है? क्योंकि इनकी width सेम है. So it is correct both ways. It is correct both ways, right? तो cusp सेम साइज के इसलिए lingual convergence नहीं है, या lingual convergence क्यों नहीं है? क्योंकि cusp सेम साइज के हैं, right? तो जिस भी तरीके से सवाल आए आप आंसर आराम से कर सकते हो, isn't it? In mandibular third molar, the occlusal anatomy is very consistent with 4 cusps, variable 4, 5 or more cusps, always 5 cusps, always 4 cusps. So which of these 4 do you think is the correct answer? Which of these 4 accurately describes the occlusal anatomy of mandibular third molar? तो mandibular third molar है, इसकी occlusal anatomy. Which of these 4 correctly describes the occlusal anatomy of mandibular third molar? 11 का B, right? Third molars, be it maxillary third molar or mandibular third molar, they have a variable occlusal anatomy, isn't it? They have a variable occlusal anatomy. Upper 8, lower 8, they have variable occlusal anatomy, isn't it? They might have lesser number of cusps or they might have more number of cusps. Both are possible, isn't it? Here we have said that 4 हो सकते हैं, 5 हो सकते हैं, या उससे भी ज़्यादा हो सकते हैं. They might even be lesser than 4, right? There might be 3 cusps, there might be 2 cusps. It might look like a premolar. That too is possible, isn't it? तो इसमें हालांकि हमने ये पॉइंट इंक्लूड नहीं किया कि इसमें लेस नंबर ऑफ cusps भी हो सकते हैं, but that too is true, isn't it? So it might even have less number of cusps. That too is true. So if I asked you which amongst the 2 upper 8 and lower 8 shows a greater variation in the crown anatomy, तो upper 8 और lower 8 में से more variable crown anatomy, which will have more variable crown anatomy amongst the upper 8 and lower 8? And the answer here would be which is the correct answer, upper 8 or lower 8? Which will have more variable crown anatomy? It is the upper 8, right? Upper 8 is more variable as compared to the lower 8. It might sometimes even resemble a premolar. Yes, very good HS, right? So it might even resemble like a premolar So if I ask you which of these two is more commonly missing, so which of these two is more commonly missing? Is it upper 8 or is it lower 8? Which is more commonly missing? Is it upper 8 or lower 8 or congenitally absent, right? Which of the two is congenitally absent, more commonly congenitally absent? Is it upper 8 or is it lower 8? Again, the answer would be same. It is the upper 8 which is more frequently missing, right? So if I again asked you, yes, very good. So if I asked you again, which is more commonly impacted? Is more commonly impacted, is it upper 8 or is it lower 8? Now the answer would be lower 8, isn't it? The lower 8 is more commonly impacted, right? तो ये कुछ एक डिफरेंसेस हैं अपर 8 और लोअर 8 के बीच में, क्या आप लोगों को समझ में आया? So more commonly impacted is lower 8, right? Mandibular third molar is more commonly impacted. Nimisha, it is the mandibular third molar which is more commonly impacted. Maxillary third molar is more commonly missing and it has more variable crown anatomy, right? So if we had to make a sequence of more variable crown or variable crown anatomy, what would we say? It is the maxillary third molar which has most variable crown anatomy, followed by mandibular third molar, followed by maxillary lateral, followed by mandibular second premolar. So this is the sequence for the variation in the crown anatomy, right? Variation in crown anatomy, right? So this is the sequence: upper 8, lower 8, upper to lower 5. Clear? So the mandibular third molar roots are usually, so mandibular third molar roots, they are usually, options are long and parallel, short and often fused with a distal tilt. Option 3 is very divergent and option D is vertical. Obviously the roots are vertical, they are not going to be horizontal, isn't it? So option D, you can say that it is correct, but is it the best? So answering the MCQ is not always about choosing the correct option. It is always about choosing the best option, right? So we need to choose the best option, and by saying this I have already ruled out option D, isn't it? So which of these would be the correct option or the best option? Short and often fused with a distal tilt, isn't it? Option B. तो यहाँ पर अगर आप देखोगे, this is the first molar, it has divergent roots, isn't it? It has divergent roots. When you compare it to the mandibular second molars, the divergence is reduced, or you can say they are more convergent as compared to the first molar. Now when you still compare it to the third molar, what you would realize is that they are often fused, isn't it? They are often fused and they have a distal tilt, right? They are often fused and they have a distal tilt. Clear? So they are often fused and they have a distal tilt, and the roots are short. Why are the roots short? The root trunk is longer. The individual roots are shorter. Also, the entire length of the root is getting reduced from first to second to third molars. फर्स्ट में हमने देखा 14 mm है, सेकंड में 13 mm हो जाती है, और थर्ड मोलर में जाते जाते ये 11.5 to 12 mm ही रह जाती है. सो द लेंथ ऑफ द रूट कीप्स रिड्यूसिंग, द लेंथ ऑफ रूट ट्रंक इंक्रीजेस. तो इसके अंदर भी रूट ट्रंक ज्यादा है, जो बाइफरकेटेड रूट या ट्राइफरकेटेड रूट्स हैं वो कम होती जाती है मैक्सिलरी फर्स्ट मोलर थर्ड मोलर में और मैंडिबुलर फर्स्ट मोलर थर्ड मोलर में, राइट? So 13th question, which mandibular molar is most frequently impacted? So I think we have already discussed it, and anyway we can include more options here, isn't it? So let's say this is the mandibular third molar, we can also include maxillary third molar. So if we did that, will our option change? Will our answer change? अगर हम ये एक फिफ्थ ऑप्शन और इंक्लूड कर लें तो क्या हमारा आंसर चेंज होगा? which mandibular molar is most frequently impacted? The answer would still be option C, third. And the biggest reason that answer doesn't change is because the question is asking about mandibular molar, isn't it? तो अगर ये सही भी होता, हम यहाँ impacted की जगह missing भी लिख देते, even then the answer would not have changed, isn't it? Why? Because the question is specifically asking about mandibular molar, not maxillary molar. Clear है? तो कभी कभी क्वेश्चंस के अंदर कुछ ट्रिकी वर्ड्स होते हैं जो हमें ध्यान देना जरूरी है. तो लास्ट क्लास में हमसे थोड़ी बहुत गलतियां हुई थी क्योंकि हमने बहुत जल्दी में क्वेश्चंस पढ़े थे, राइट? So let's go to the next question. Which mandibular molar is most prone to caries? So which of these is most prone to caries? Options are first molar, second molar, third molar, none. तो क्या लगता है? Which of these would be most prone to caries? Obviously option D, none तो हमने इसलिए इंक्लूड किया है क्योंकि फोर्थ मोलर नहीं है एंड फोर्थ ऑप्शन कुछ ना कुछ तो देना था. तो obviously option D can easily be ruled out, isn't it? So which of these is most prone to caries? The one that exists in the oral cavity for the longest duration, isn't it? And the one which will have more grooves. So obviously first molar, it also has more grooves and it exists for the longest duration, isn't it? So first molar is most prone to caries. Now I'm not saying that it has maximum supplemental grooves, but yes, it has more developmental grooves, isn't it? Supplemental grooves तो second molar में ज़्यादा होते हैं, but then it is there for a lesser period as compared to the first molar. Also, when it erupts at around 13 years of age, बच्चे भी समझदार हो जाते हैं, ब्रश करना उन्हें समझ में आ जाता है. By 6 years of age, बच्चे भी उतने समझदार नहीं है, ब्रश कर रहे हैं नहीं कर रहे हैं, we don't know. So oral hygiene is also a factor, isn't it? And that is the reason first molars are most frequently affected. The mesobuccal cusp of mandibular first molar, so again mandibular first molar, और इसका कौन सा? Mesobuccal cusp. So mesobuccal cusp of mandibular first molar is, so we have to discuss its feature: narrow and sharper than distobuccal, broad and less pointed than distobuccal, equal in size to distobuccal, and smallest cusp overall. So obviously we can rule out option D because we have discussed it more than once that mesobuccal is the largest cusp, isn't it? So option D can be ruled out. Equal in size to distobuccal, again this can be ruled out because we have already discussed that this is larger than the distobuccal cusp. Narrower and sharper than distobuccal, again this word narrower makes us rule out this option, isn't it? Because it is the largest cusp. And when you take a look at its picture, so when you see the mandibular first molar, what you'll notice is this is the mesobuccal, this is the distobuccal, isn't it? Mesolingual, distolingual cusp. So what do we notice here is that mesobuccal is larger and it has an obtuse angle, isn't it? Its cusp angle is obtuse. This cusp angle is obtuse, whereas the distobuccal cusp, it has a cusp angle of almost 90 degrees, right? So the cusp angle of the distobuccal cusp is almost 90 degrees. Almost 90 degrees, right? So yes, it is broader and it is less pointed. So option B is the correct answer. Because the distobuccal cusp has a cusp angle of almost 90 degrees and the mesobuccal cusp is obtuse, right? So when you compare these buccal cusps to the lingual cusps, which cusps are sharper and higher? ये तुमने अभी डायग्राम देखा तो डायग्राम तुमने ढंग से देखा ही होगा मेरे ख्याल से. So amongst the buccal and lingual cusps, which are higher and sharper? Which of these cusps are higher and sharper? So option A is buccal cusp, option B is lingual cusp. Easy, isn't it? So which of the two are higher and sharper? Lingual cusps. Very good. So lingual cusps are both higher and sharper. So if I asked you from which of the two views, buccal and lingual, all the 5 cusps will be seen. So which of these two views will show all the 5 cusps, the buccal view or the lingual view? Obviously the answer is right in front of you, isn't it? From the buccal view, we can see all the 5 cusps, but from the lingual view we can see only 2 cusps, that is the lingual cusp, right? And also you can notice that the mesiolingual cusp is the highest and the sharpest cusp, right? Mesiolingual cusp is the highest and the sharpest cusp. Very good, Shefali. So from the buccal view we can see all the 5 cusps, and the mesiolingual cusp is the highest and the sharpest cusp, whereas the mesiobuccal cusp is the largest cusp. Very good everyone. Shefali, Nimisha, दोनों ने सही आइडेंटिफाई किया, बकल व्यू से ही 5 कस्प्स दिखेंगे, राइट? So which root of mandibular first molar is most likely to have 2 canals? तो मेरे ख्याल से RCT आपने की होगी, नहीं भी की होगी तो एटलीस्ट देखा होगा, राइट? So we have just 2 roots, mesial and distal, right? We just have 2 roots, mesial and distal. So which of these two will have 2 root canals? Which of these two commonly has 2 root canals? So which of these 2 roots has most commonly has 2 root canals? So obviously we can rule out option C and D, isn't it? Yes, very good. Option A, that is mesial root, most commonly has 2 canals, mesiobuccal and mesiolingual, isn't it? So we have 2 root canals, mesiobuccal and mesiolingual. Acha, when we are discussing these root canals, can you tell me which tooth commonly has a C-shaped canal? Is it mandibular first, is it mandibular second, or is it mandibular third molar? इनमें से कौन सा मोलर होगा जो मोस्ट कॉमनली सी शेप कनाल एग्जिबिट करेगा? Yes, very good. It might have 3 canals, and it is the mandibular second molar which most commonly exhibits a C-shaped canal. Right, so what is a C-shaped canal? So basically, let's say these are the 2 canals, mesiobuccal and mesiolingual, right? So usually what happens is that they can be easily identified separately, but sometimes the isthmus between them is connected. So isthmus between them is sometimes connected, and that is why they appear like a C shape. Clear? So that is what a C-shaped canal is. Both the mesiobuccal and mesiolingual canals, they appear to be connected, and that forms the C-shaped canal. And it is the second molar which most often exhibits the C-shaped canal. Yes, very good, Nimisha and HS. It is the second molar. So the mesial contact area of mandibular first molar is located. So the location of the mesial contact area, right? So let's say this is the first molar, this is the second molar, and this is the third molar. So we need to find out the location of the mesial contact of the first molar. We need to find out the mesial contact of the first molar. So always remember that for any posterior tooth, premolar हो, molar हो, maxillary हो, mandibular हो, simple rule है, mesial contact is at the junction of occlusal and middle third, and the distal contact is in the middle third. The only exception to this rule is mandibular first premolar. So the only exception is mandibular first premolar. Here distal contact is higher than mesial contact, right? So apart from this mandibular first premolar, everywhere else the mesial contact is higher as compared to the distal contact. Also, in all the posteriors, the mesial contact is at the junction and the distal contact is in the middle third. Which another tooth does not have its mesial contact higher than the distal contact? So apart from the mandibular first premolar, which other tooth does not have its mesial contact higher than its distal contact? So what would you say? Which tooth does not have its mesial contact higher than the distal contact? Though I am saying that this is the only exception where the distal contact is higher, right? This is the only exception where the distal contact is higher. The lower first premolar is the only exception where the distal contact is higher. Yet I am asking which other tooth does not have its mesial contact higher than the distal contact? ये गलत है. Let me give you the options. चलो, so we have excluded your answer. ठीक है HS? Now can you answer amongst these options? इन options में से answer कर सकते हो? Which other tooth does not have its mesial contact higher than the distal contact? So maybe the mesial and the distal contacts are at the same level, isn't it? They are at the same level at the incisal edge. Option 1, that is lower central incisor. So the lower central incisor is the only tooth where mesial and distal contacts are at the same level, right? This is the only tooth where the mesial and distal contacts are at the same level and they are close to the incisal edge, right? Mandibular central incisor. So mandibular central incisor is the only tooth where the contacts are at same level, and mandibular first premolar is the only tooth where the distal contact is higher, right? So option A is correct. Very good. So question number 18. A patient's radiograph shows mandibular molar with roots nearly parallel. So first thing is roots almost parallel, right, and closely spaced. So parallel means there is no divergence and the space is low. This is most likely. So which tooth are we talking about? Which tooth are we talking about? Is mandibular first molar or second molar or third molar? कौन से दांत की हम बात कर रहे हैं? या ऑप्शन डी, maxillary second molar. Which tooth are we talking about? On the radiograph, the roots appear parallel with a closed space visible between them. That means there is less space. The space is less between the roots. So which tooth are we talking about? Option A, B, C or D? क्या आंसर होगा इसका? A, B, C या D? इसका आंसर क्या होगा? Had the question been the roots appear divergent, then we could have gone with option A, that is mandibular first molar, because there the roots are divergent. And had the question been the roots are convergent instead of being parallel, right, or they appear fused, then we could have gone with mandibular third molar. Option A cannot be the answer. The roots are not parallel, they are divergent, isn't it? In the mandibular first molar, the roots are divergent, as I have shown you in the diagram, isn't it? मैंने यहाँ diagram में भी दिखाया, the roots are divergent, isn't it? The the roots are divergent. Whereas in the second molar, as compared to the first molar, they are less divergent. So you can say they are more or less parallel. In the third molar, what happens is the roots become convergent. The roots become convergent and they fuse, isn't it? So in the first molar they are divergent, in the second molar they are relatively parallel, and in the third molar they are convergent, right? So in the third molar they will be convergent, and in the second molar the roots are almost parallel. So the space is less as compared to the first molar, yet the space is there. So most likely the tooth in the question is mandibular second molar and not first or second molar or first or third molar. Is it clear? अभी वैसे तो होने को कोई भी टूथ हो सकता है, राइट? फ्यूजन फर्स्ट मोलर में भी मिल सकता है, सेकंड में भी मिल सकता है, थर्ड में भी मिल सकता है. So it could be anyone, but most likely it is second molar, right? So this is the last question for today. If the central developmental groove, right, central developmental groove of a mandibular molar forms a smooth straight line from mesial to distal pits. So these are the mesial pit, this is the mesial pit, this is the distal pit. In mesial marginal ridge, a distal marginal ridge. So if it forms a smooth line between mesial and distal pit without much irregularity, it is most likely which tooth? Which tooth are we talking about? A mesial marginal ridge, a distal marginal ridge. This is the mesial triangular fossa, this is the distal triangular fossa. So between mesial and distal triangular fossa, the groove runs more or less straight, right? So which tooth are we talking about? Again, probability. Most probably, which tooth are we talking about? Yes, very good. It is the mandibular second molar, isn't it? It is the mandibular second molar. As we have discussed, mandibular second molar shows a cross or plus shaped central groove pattern. So the central groove runs more or less straight from mesial to distal triangular fossa, right? In case of first molar, the groove is Y-shaped, so it is more irregular. And the third molar, again, it has a variable anatomy. It could resemble first molar, it could resemble second molar, or it might have some other unique pattern. Is it clear? So this was the last question. Do you have anything to ask? Do you have any questions? Any doubts? I'll check and let you know about it. Radiologist pattern. Right now I don't remember it, Radiologist pattern. So I'll check it once and then I'll let you know, right? So apart from it, anything else? Embrasures. Usually there are 4 embrasures, right? Occlusal or incisal, then there is gingival. Yes, I'll tell you briefly only. Occlusal or incisal, then there is gingival, then there is buccal or labial, and fourth one is lingual. So whenever you compare these, always remember that the gingival embrasure is larger than the occlusal or incisal embrasure, and the lingual embrasure is usually larger than the buccal embrasure or the facial embrasure. See, in anteriors, the contact, the proximal contact is usually labio-lingually centered. So there is not much difference between the lingual or the labial embrasure in the anteriors. But as we move posteriorly, the contacts, they are more buccally, right? The contacts, they move more buccally. In the posteriors, contacts are more buccal, and therefore lingual embrasure is larger than the buccal embrasure. The only exception to it is the embrasure between upper 5 and upper 6. See, the upper 6 has cusp of Carabelli, and therefore its lingual surface is heavier as compared to the other molars, and therefore this embrasure between 5 and 6, here buccal embrasure is larger than the lingual embrasure. Rest everywhere, it is the lingual embrasure which is larger than the buccal. Gingival is larger than the occlusal. Also, as we move posteriorly, the size of gingival embrasure reduces. The gingival embrasure would be largest amongst the anteriors. As you move posteriorly, the size of this gingival embrasure, it will keep on reducing, right? It will keep on reducing. So this gingival embrasure, as we move posteriorly, it will keep on reducing. Also, another thing that you might be asked is largest incisal or occlusal embrasure. So largest incisal embrasure would be obviously between the anterior teeth. So largest incisal is between upper lateral and canine. Beta, it would take almost half an hour if I try to explain it to you, and we don't have that much of time. But we have already covered it in one of the previous classes, right? We have already covered it in one of the previous classes. क्योंकि इसको एक्सप्लेन करने में बहुत सारा टाइम निकल जाएगा, तो पूरी ऑलमोस्ट एक क्लास चाहिए. तो या तो हम ये करेंगे कि नेक्स्ट क्लास जो अभी मेरी आ रही है उसमें हम क्रोनोलॉजी पूरी डिस्कस कर लेंगे, ठीक है? तो उसमें हम प्राइमरी परमानेंट दोनों की क्रोनोलॉजी डिस्कस कर लेंगे. अभी मैं तुम्हें ये बता देता हूँ. तो लार्जेस्ट इंसाइजल इज बिटवीन 2 and 3 and largest occlusal is between 3 and 4. Yet if you compare the occlusal or incisal embrasure between these two teeth, or if you compare the relative size 3-4 and 2-3, what you would notice is that 3-4 occlusal embrasure is larger than 2-3 incisal embrasure, right? तो ये चीजें कुछ हैं जो आपसे पूछ सकते हैं कि लार्जेस्ट इंसाइजल embrasure कौन सा है, लार्जेस्ट occlusal embrasure कौन सा है, then which is larger than which embrasure. So gingival is larger than the occlusal, lingual is larger than the buccal. Exception is upper 5 and 6. That's it. बाकी सब routine है फिर. Anything else? निमिषा, हम इसको अगली क्लास में डिस्कस कर लेंगे पूरा, ठीक है ना? क्रोनोलॉजी पूरी ले लेंगे, प्राइमरी एंड परमानेंट दोनों. और कुछ पूछना है? ओके देन, तो हम नेक्स्ट क्लास में मिलते हैं. और अभी जैसा कि अपन ने डिस्कस किया, नेक्स्ट क्लास में हम क्रोनोलॉजी डिस्कस करेंगे, राइट? Chalo then, good night.